Hi everyone. Welcome again to the Borderline Personality Disorder Family and Consumer Education webinar. Today we're joined by Dr. Karen Adler, who's going to be speaking on how to speak borderline. Not that it's a different language, but I think sometimes for families and loved ones, it sometimes feels like a different language. And we're going to be following up on the webinar that Dr. Adler did on how to talk about conflict and how to navigate conflict more effectively. Before we get started, a few logistical announcements. All of your microphones have been muted and nobody can see your identity, but we do want to make this as interactive as possible. So if you have questions, if you have cases, scenarios that you want us to try to role play, please type them in the lower right-hand corner in the Q&A box. We have a variety of resources for you available in the lower left-hand box. But just to let you know, today's webinar is going to be a very different format than anything we've done so far. We're going to be doing a lot of role plays, and I want to introduce and acknowledge Megan, who has borderline personality disorder, and she has courageously and graciously agreed to join us and do role plays with Dr. Adler on a lot of different scenarios that have already been pre-submitted from participants, and we will try to get through as many of them as we can. And if you type in additional ones, we will get through as many as we can. And so I think without further ado, you know Dr. Adler, and I will welcome to the webinar Megan.
Thank you, Dr. Palmer. Megan, thank you again so much for joining us. I think that the family members and loved ones will really benefit from your firsthand understanding of how communication can be interpreted, misinterpreted, different perspectives that it's hard to understand if you're not actually living with borderline personality disorder. And as Dr. Palmer said, the title is a little bit tongue-in-cheek in that, it certainly is not a foreign language, but can feel that way sometimes to loved ones. And actually, I think to people with BPD, because they often feel that, what they're saying is so clear, and yet the responses are quite misunderstood. So, Megan wanted to actually just introduce herself with a personal account of what it's been like for her living with borderline personality disorder.
My name is Megan. I have borderline personality disorder. That was misdiagnosed for over 15 years. This is why I think it's very important to understand the symptoms and learn to cope with the effects it has on families. It is an unintentional, selfish way of thinking. I don't mean people with borderline personality disorder are selfish at all. In fact, I think it's that we overthink. I have found myself in situations where I say and do things I don't mean. This is always followed by guilt and shame and a feeling of unworthiness. It's self-preservation from a perceived threat or a feeling of being wrong that is often untrue. I often isolate myself because of thinking people are looking at me and judging, people that I don't know and will never see again, as well as friends and family. Just like with young children, it's like a tantrum in a way. When one of my friends or family members is trying to help and says the wrong thing, I think it's so hard to understand for people because it's like saying, F off, leave me alone, talk to me but don't, show me you care in my way, often a way that I don't even understand. I can only speak for myself, but I get myself in dark places where I want nothing from anyone, yet get hurt when people stop trying to reach out. In a lot of ways, I think working with an illness as complex and complicated as borderline is extremely difficult on both loved ones and providers. It's hard to know what people want in general, then add borderline personality, and it feels impossible for both the person with the illness and well-meaning loved ones. It is such a complex and deep-rooted illness that the emotions and actions may be misplaced and misunderstood easily. which makes it even harder to treat and understand. It is intense for loved ones to handle. People with borderline, I completely lost you.
That can be very spiteful. You're right there.
People with borderline can be very spiteful and mean when in a bad place. A mood can change based on what would change nothing for others. The most straightforward thing I have worked on with my family is that validation of my feelings is important, even if it makes no sense. Boundaries are important because there are lines I just do not want to cross, which I believe to be true of all people suffering with borderline. What I mean is I can't want someone to hug me and go away in the same moment. Yet this is a common feeling. I hope a perspective from someone suffering from borderline is helpful to some.
Thank you. So another quote from this is now from Pinterest that I have borrowed a few quotes again from people who are writing about their own experience. So this is about specifically borderline personality disorder and loved ones. What makes BPD different from any other personality disorder is that your anger and impulsiveness, acting out, kicking over a chair only happens when you're dealing with people you really love. If it's somebody you don't care about, who cares? And I think parents and other loved ones can definitely relate to this experience of feeling that they are the target often of their loved one's anger, even though they're the closest person, their greatest support. So then, given these complexities, how is it possible to have a positive relationship, good communication with your loved ones with BPD? This time we're borrowing from Facebook, but listen to us, but try not to judge. Educate yourselves on the condition, love and affection, stability, reassurance. Be clear and honest with us. Know that we do love you and we are grateful to you for your love and support. Understand that we need alone time. Try not to take things to heart when we are upset or angry. We don't mean them, but lack the skills to express our emotion in a more controlled way. So I think that, that real lived experience covers a lot of what I had explained, in sort of more multisyllabic words in my last webinar, but just to do a little bit of a refresher, the one thing that, is really helpful to keep in mind is that people with borderline personality disorder are very, very highly sensitive to perceiving that they're being disliked, judged, criticized, or disagreed with. And when that happens, that really influences their mood. And in a way that may not be as obvious, because oftentimes shame and self-doubt are the more prominent emotions underlying, but what comes out to, the loved one is more anger, defensiveness, and aggression. So, oftentimes it may be helpful to ask yourself, the person's acting angry, but is there something they're feeling shame or judgment over? And then around validation, that what you're validating is feelings, not facts, and it's not the same as agreeing with an opinion that you actually disagree with. You are allowed to have your own opinions. You can validate the way someone else feels without having to say you feel the same way. It's not about endorsing things that are just factually inaccurate, and it's not about actually giving in to something that's unreasonable because you can understand the person's feelings. So in DBT, we often say you can only validate what is valid. And the idea is that when you do have a different point of view, or your memory of the facts is a little different than what's being told to you, you want to try to understand and validate the person's feelings first, which helps them calm down, and then offer your own perspective. And both parts are equally important. So moving to your examples, thank you everyone for submitting your examples. These were all so good. I wish we had more time, but we tried to hone in on some that kind of echoed some common themes. So the first one we have, this is the scenario. So my daughter's mood can change very suddenly. When it happens, her behavior can become quite volatile, at which point I lose control of the situation. Here's a recent example. We were in the car, and she was driving, her car, sorry, and she was driving, talking about herself, expecting me to listen intensely. Then I saw someone we know through the car window, and I said, "Oh, look, it's Sue." In reaction, she brakes sharply in the middle of the road and shouts at me for not paying attention to her. I felt fear and helplessness, as I did not expect such an intense reaction, and I felt vulnerable being in her car, lest she would attack me physically or throw me out of the car. What technique can be used to restore the calm? So first, understanding the reaction. So, I mean, I guess I'll start, and Megan, jump in if you have other thoughts on this. But my thought here is that the daughter is probably talking about something that feels incredibly sensitive and important to her. And the aside of, oh, look, there's Sue, was probably interpreted as a sign that the parent was not interested, not listening. So she felt hurt, unimportant, and just reacted without thinking about the consequences to the feelings of being, in her mind, being ignored or not attended to. Would you add anything to that?
No, I agree. I think it's also a common reaction to, in general, like a baiting kind of. People oftentimes with borderline can think you're not listening just because of a tiny little misunderstanding that can get blown completely out of proportion sometimes when someone feels like they're talking about something very important.
Mm-hmm. And maybe honing in on the one thing that seemed inattentive versus maybe all the other stuff that mom or dad were doing that was, demonstrating the listening. I would say that I hear about conflict in cars quite a bit. This is just an aside. And I think this is, it's hard because sometimes it's the only time people feel like they have a chunk of time where there's, they're by themselves, there's not all the other family members there, they have some time where they're driving, it's kind of a captive audience. It's on both sides, parents and people with BPD tend to bring up sort of these important topics while driving, but it's usually not the best forum because, when you're driving is not necessarily the time that people want to bring up something that's emotionally volatile or, even feel, sort of trapped in a conversation. So that's just something I'll throw out there, that try to plan separate times to talk about things, even though it's tempting to use the time that exists in that way. So then moving on to sort of, well, how do you respond to this, right? Because this is a pretty unsafe situation. And in this case, you do want to prioritize safety over emotional validation in the moment, right? Because you're on the road. I don't know if this was a highway or, just like a country road or what, but the point is, make sure everyone's safe. So I think we can try, Megan and I can try to role play it from this point a little bit. And one thing I want to say before we start is that your immediate response may not get a positive response from the person. So, we'll model that and just model kind of sticking with it a little bit, because when someone's that upset, it's unlikely that you're going to kind of get them to say something calm and reasonable after one sentence. So, you're really upset. I'm sorry. Let's pull over so we can both calm down and regroup.
Why am I really not that important to you?
No, you're incredibly important to me, which is why I want us to get off the road so nothing happens to you.
Right, whatever.
Okay. I know you're still mad. Do you want to get out and smoke a cigarette or take a walk, and you need a little space before we talk about this?
Whatever, fine.
Okay. Thank you. So once, you've sort of gotten yourself to safety, say that, then you want to try to validate the feelings. And at this point, you're still in the car. You can kind of keep this brief. Don't make this a huge discussion, but just come up with an immediate plan to kind of get to wherever the destination is. And then a larger conversation can happen later. Megan, I'm sorry. You were talking about something that was really important, and I know it sounded like I wasn't paying attention when I was looking out the window and noticing people. I actually really was very interested in what you're saying, and I want to hear more. But we also have to make sure that no matter what's going on with your feelings, that we're not putting ourselves in danger. So why don't we switch drivers until we get home, and then we can talk more or not.
Fine, if that's what you think is safe. You think I'm that bad of a driver?
Absolutely not. I just think that if I were feeling the way you're feeling right now, I would gladly hand over the keys to you.
Fine.
Okay, thank you. So then after, you're no longer in the car and everybody's back in their own spaces, one thing is just that it's okay you don't have to process this immediately. Everyone can kind of take some space, cool down, come back to it when you're both calm. And that probably goes something like, thank you, that was very mature. I know you didn't really want to pull over and switch drivers, but I really appreciate it. Do you want to talk about what happened right now, or do you want to come back to it later on? I do think it's important, but I don't want to push you right now.
I think I need some space.
Okay, fair enough. You want to just let me know when you're ready?
Sure.
Sounds good. So, Megan, some of these ones were your ideas. Do you want to share?
Yeah. And number one, I think it's important also that if the daughter, which is possible, the daughter doesn't calm down and continues to drive recklessly, that at that point, obviously, there's a lot of safety that is, not only hers and yours, but everybody else on the road, that if the person doesn't calm down, that it's absolutely something that you might have to call the police. But if the person does calm down and does agree and goes home, it's okay to need your own space after this incident because it's hard to validate when your daughter put you in that position. Come back to it when you're calm. Share your point of view, especially concerns about safety. Validate her emotions and express calmly that slamming on the brakes is very reckless. It's okay to be upset with me, but not to endanger the lives of others. Engage daughter in problem solving for the future. Express the importance of both hearing her and being emotionally regulated while driving. Remind each other not to have emotional/important conversations in the car. I really think it's important to try to turn it around as a question for someone with borderline is ask her how she could have handled it better. Is there a way that you can react without endangering other people? Is there a better place for us to talk rather than in the car? Where would you like to talk? Go get coffee? When would you like to have important conversations? So that it feels like it's that person's decision, not just being forced on them.
Mm-hmm. And that the topic of conversation isn't just being dismissed because the person got reactive. I think that's important too. So how, if you could put yourself in this situation, which I know would probably take you back 10 or 15 years, but if I'm the mom and I said, I feel better, now that we've talked, but I am wondering if you have ideas about how you could have handled that better, differently.
I think at first I'd probably be pretty defensive, not wanting to acknowledge that I had done something wrong to endanger anybody. And I think being asked to, consider how I could have done something differently, and also being acknowledged that these conversations are important to you as well, that we would be able to work out a different place to have important conversations.
Yeah. And then I would say the follow-through on that is important, to set something up and keep the plan pretty immediately, because there's going to be a pretty high suspiciousness factor on whether, parent is going to come through on that, right? Yeah. Okay. So next scenario, we've tried to pick some challenging ones here, so that it hopefully feels like not like we're just kind of hitting the softballs, but we'll see what we can do. So my 23-year-old daughter just completed a 45-day residential BPD program. She is home and continues to suffer from deep anxiety to the point that she was unable to start her intensive outpatient program. She believes Xanax, which is a anxiety medication for those who may not be familiar, is the only thing that will help, which she does not have. She abused Xanax in the past, and she is using alcohol as a numbing agent. I believe that she's an alcoholic, but she doesn't. How can I talk to her about her drinking or any other addictive, destructive behavior without her exploding? The without her exploding part, I think the caveat is that it may not be possible that there are no explosions in these kinds of conversations. It's more around trying to ride them through and kind of get to a place where there can be some communication instead of having that shut down the whole conversation, because then the explosion can actually turn into a pretty good avoidance strategy. So we have a second part to this one, which is some examples that the parent has tried that have not worked. So sympathizing by saying it must be hard to feel anxious all the time, sharing that the parent also feels anxious, I've suggested she use some of her coping skills that she's learned. I've suggested she talks to friends at the treatment program and see how they cope with anxiety. Her response is that none of them suffer from anxiety. I try to say that using substances to soothe and numb makes things worse. Her responses have ranged from yelling at me, saying that I never help, asking me to go get Xanax for her, and saying that she hasn't learned anything helpful in treatment. I rarely raise my voice, but she often says I am yelling at her. So challenging situation, for sure. In terms of understanding the reaction, it sounds like this parent already actually has a good understanding of her daughter's anxiety and strong emotions, that these are genuine and painful feelings, which is a great first step to have, that empathy about her experience. And I'm guessing, and Megan, I'm curious about what you think, but I'm guessing that she actually probably knows that her using alcohol to cope is not the healthiest strategy, but doesn't see alternatives and doesn't like the judgment that she may feel is implied with the term being an alcoholic. I'm guessing that probably produces shame and some self-criticism, and then a defensive reaction or denial. And I'm also guessing that although it's a natural empathic response to say, hey, I get it, I get anxious too, or talk to some other people and figure out how they cope with anxiety, that it may feel either like if all these other people actually have the same level of anxiety but seem to be functioning fine, including my parent, what's wrong with me? Or it may feel like, that the degree or the severity is so different that the parent just really doesn't get it. Anything you would want to add to that?
I would agree. I think that trying to empathize is a good thing, but to say I sometimes feel anxious too, sometimes it absolutely can make a person feel like, well, why can't I deal with it? And by saying nobody else had anxiety, really probably what she means is that nobody else can't deal with anxiety like I can. That's basically my
Well, in terms of how to respond to this one, it's challenging because it's very hard to watch someone you love, especially someone who's a young adult, but an adult, make self-destructive decisions and not really have a great way of getting them to do something healthier. So I would say to try to address the concerns about the drinking without debating the labels. I think I left out some words there. But, you know, to get away from the terminology of an alcoholic, but more something like, I can see how anxious you've been, and I believe that you may be using alcohol to cope with that anxiety. I get why that may feel like the best choice you have right now, but I am worried about the downsides, the consequences.
Why? I mean, drinking helps, and you won't get me Xanax, though.
Well, that's true, and I imagine there are some things that drinking does help with, but do you see any downsides?
Get a hangover sometimes.
Yeah. That doesn't sound like much fun.
Well, as long as I'm not feeling anxious, it doesn't matter.
I mean, do you want to hear what are some of the things that I worry about?
Whatever. Fine.
Okay. I mean, one of the things that I worry about is your health long term. Alcohol is pretty bad for your liver, your heart, your brain. You're such a smart girl. Really don't want you to have to suffer with those consequences long term.
I understand that. But I don't know how else to deal with it.
Would you be open to some help?
I don't know. I already got help, and it didn't help.
It's got to be really hard. You feel like you were in that program for so long and you came out of it and you don't feel better.
It is. It is hard. And nobody gets it. Nobody will give me the medicine that helps me.
I wonder if there might be other medications that maybe they wouldn't help quite as much, but maybe they'd be safer for you.
I have no idea. I don't know.
Probably a good place to pause on that one. But, you know, you can see that it wasn't like you were really enthusiastic about this conversation to begin with. But do you want to say anything about what helped you soften a little or stick with it?
The fact that you were validating my emotions, not trying to tell me what to do. The fact that it wasn't a judgment. It wasn't calling me an alcoholic or a drug addict. That you actually wanted to help me rather than tell me what I should be doing or should not be doing. I think that when it can often feel attacking if you're being called an alcoholic, and if something feels like it worked and it was taken away from you, it can often feel like the only solution is to either drink or, do something reckless to try to help yourself. And there is a lot of guilt and shame behind that and denial. This is something that I can relate with personally too.
So one question I want to pose to both of you on this scenario. I'm imagining for some people, not everyone, but for some people, it also might be an expression of anger that treatment isn't working, anger that you and the treaters aren't getting it, they're not giving me what I need, so therefore I'm going to be a little bit self-destructive. If you consider it self-destructive, fine, go ahead and consider it that, but this is the only thing I can do to make myself feel better in the moment, and I get that it may not be the best long-term solution, but until somebody gives me something that's going to work in the short run, I guess this is what I have to do.
I find myself sometimes not thinking about the long term, like the effect that alcohol would have on me in the long term, but what it's doing in the short term. And absolutely that I'm not getting what I need. My providers are not helping, so they're not giving me the medicine that I need that was helping. So to do something self-destructive, even though it's not, probably not thinking about the self-destructive part, just doing what I think I need to do to make myself feel okay. And it is an expression of anger to just do something reckless that, is probably not the best plan, but feels like it in the moment. And maybe even if I drink irresponsibly, then maybe someone will actually give the medicine back to me. When in fact it does the opposite.
Yeah.
Yeah.
Yeah. Yeah.
So any tips for parents if they suspect something like that might be going on? Almost like an expression of anger, or we could almost call it a cry for help, that like, you don't know how bad my anxiety is, nobody's paying attention, so I'm taking desperate measures because this is really desperate. I mean, you could frame it in a lot of ways, but how do you talk to somebody, or how do you help somebody who's going through that and yet try to encourage them to practice safer coping mechanisms? Or
I think that maybe not putting a label, like saying you're an alcoholic, maybe offering to go to an AA meeting just to get information, so that maybe she can see what's going on, and going with her. Sometimes that might make it seem more like a person, like a parent is actually caring, like being understanding of the fact that that medication was helpful, but at the same time, expressing that, no, I can't go and get you Xanax. That's not actually something that I can physically do. It's not legal, but what can I do to help you? Instead of saying, like, I understand, I get anxious too, asking her, what can I do that's going to help you feel better, that's not dangerous for you? To express concern without a judgment, offer to go to AA, and educate yourself on other medications that help with anxiety, that may not have the same effect, but may help some. And also recognize that you're not probably going to get the best response from your daughter at all, especially not in the beginning, because it definitely would feel like something that really worked was just yanked out from underneath somebody. So.
Yeah, I mean, I think that one thing that can be difficult is the tendency to not want to kind of join with the hopelessness or the anger about treatment not being as effective. But, I mean, one thing that most of us know as treaters is that the more self-destructive forms of regulating your emotions do tend to regulate emotions quicker and in a more dramatic way than most of our skills do. It's just they have pretty serious and negative consequences. So I think it's, it's a hard line, but I think it's reasonable to actually validate the anger. Like, hey, I'd be pissed too if I was doing all this treatment and I still felt so crappy all the time. Like, I get that. And the problem is that your solution is another problem. So you may have to find a solution that's like, 75, 80%, but it doesn't like have its own consequences as a result of that. So you're kind of holding both sides that, you can understand the draw, but it's not acceptable. And there may be a point where there has to be a line in the sand about, if you want to continue to live here, if you want to continue to have our support, you need to get some help.
Say that oftentimes people with borderline feel the need to have control over something when everything feels out of control, whether that be a substance or an eating disorder, something like that. I know that is how I have felt, that when everything feels out of control, I want to have control over something, even if it's something that's self-destructive.
Something you can do that what it's going to do,
Right.
like for you or to
Yeah.
you, or. Are there any questions we should pause for at the moment? Okay. So our next scenario, I think, is probably something I'm imagining many of the audience members may relate to, and I think certainly many of us clinicians can relate to. So our daughter will tell us that she doesn't want to live anymore and she wants to die. When she does this, we bring her to the ER. Once she's there, she's calm and says she no longer has those thoughts, and they send her back home. When she gets home, she starts saying the same things again, and sometimes in the same day. How do we deal with these situations? We are terrified she will hurt herself, but we can't keep engaging in the cycle. So understanding the reaction in this situation is a little bit complicated because you'd have to know a bit more about what is the underlying function of this statement of I don't want to live anymore, I want to die. Like, does the person really want to be dead? Are they actually saying, I'm in pain and I can't stand it, something needs to change, I need to escape from the situation? But it sounds like that's probably more of what it is based on what happens in the ER, that something calms down for her there, whether it's feeling heard or feeling like there's a change of environment or a safe space, getting to talk out whatever the problem was, and then there's some emotional re-regulation that happens and she's ready to go home, but then the same stressors probably pop up again, or maybe she starts ruminating or texting with a boyfriend or doing something that brings the distress back into the picture. So I think that's something that, for a family, especially hopefully if there is a clinician involved, to talk through like how likely is it really that something dangerous is going to happen when my child is saying these things, and if it's really not that likely, and there's not been a history of actual harm, or the things that she's saying don't sound like likely to be carried out in any way, then it may be more helpful to see this as a communication of overwhelming distress and try to respond to it, trying to respond to the underlying distress as opposed to the I want to die statement, because that actually is just kind of going on a loop, and can become kind of reinforced that way of communicating distress. So one thing is to try to ask, what is going on so bad that made you, feel that you don't want to be alive anymore. Try to get at what the underlying feelings are, and then talk about what else besides using the ER could be helpful when she's feeling that way. There may be things to do like distract, watching movies together, taking a walk, cooking a meal, just getting her mind off of what's going on and feeling comforted by the family, and having a healthy outlet could actually hopefully kind of provide some of the same re-regulation that happens without the trip to the ER. So we can try that scenario too, because the balance here is not making it seem like you think the person is doing this intentionally for attention, because it's usually not how people are thinking about it in the moment.
Right.
When they're saying it, they mean it. It just changes.
Yeah. I think that it's definitely like someone can say, I feel really unsafe right now, but that's the thing about borderline, is that you can feel something very intensely in a moment and then 20 minutes later feel something else just as intensely, depending on a person, a place. It all just depends. You can feel absolutely helpless and like you want to die one minute, and then the next minute someone can call you an ex-boyfriend, a friend, and make you feel great, and then you feel fine. It is a very complicated situation, and obviously these parents, any parent would want to keep their child safe. So to try to do something other than just going to the ER every single time.
And Megan, I didn't put this on the slide, but I remember when you and I talked through the scenarios, you had made a really good point, which is that if there is a clinician involved, and there is some, some real concern about risk and what this person has done in the past or what they might actually do, that it would be helpful to get the clinician to work with the ER to actually have a psychiatric hospitalization rather than like this sort of rotating door with the ER, and that in itself may be a deterrent to further ER visits, at least for some.
Yeah. I have not ever done like the ER cycle, but I have certainly done the I'm not safe cycle and talked myself out of an ER. But then once I actually got hospitalized, that was definitely a wake-up call for me to realize, wait a minute, I don't want to be on a psychiatric unit at all. And actually helped me to learn healthier ways of dealing with things. And actually, instead of just saying, I don't want to even acknowledge that I have borderline personality disorder, I actually did CBT and did things that are actually helpful, that I never, ever wanted to actually engage in before. So I definitely think that if they're going to do this cycle of the ER, that if they are engaging in dangerous behavior, that maybe a wake-up call of being actually admitted onto a unit instead of just an emergency department could be a wake-up call for somebody.
Mm-hmm. Yeah, because it sounds like when they get sent home, they're not protesting that. Yeah.
It's not a realistic cycle to continue. It's not one that people can realistically live with, not the person with borderline and not the parents either.
Mm-hmm. Or the healthcare system, really.
Right.
So let's try out having this conversation about what's really bothering you.
Okay.
So let's set the scene as like this is after we're back now, and you no longer want to die. So, Megan, I'm glad you're feeling better, but I'm kind of confused. Like, what was going on that was so bad 2 hours ago that you actually didn't want to be alive anymore? And how did that change so fast for you?
I don't know. Why are you unhappy that it changed?
I had a feeling you were going to say that. No, I'm grateful that you're feeling better, but I never want you to feel like that, that something's so bad that you don't want to be alive. I just want to try to understand what happens for you when you get to that place.
I just sometimes feel like dying.
Like, well, today, what was it that happened, or what were you feeling before you had that thought?
My boyfriend broke up with me.
Oh, I'm sorry. That's really tough.
Yeah. I don't feel like you get it, though.
Can you tell me more so I do get it?
I don't really know what to say. I just felt like dying. And then he apologized, and I feel better.
So something about not being with him was so bad that you didn't want to be alive anymore?
Yeah. Really upset me. If I'm not with him, then I don't want to be alive.
Oh. So is that kind of what's been going on with all of this back and forth, that you guys get into fights and then you don't want to be around anymore, and then things get better and you feel better, and
I don't know.
Well, that's got to be really hard on you to feel like your emotions are being yanked all over the place like that.
Yeah.
Is there something else that Dad and I can do besides bring you to the hospital when you feel this way? Because it does seem like, maybe that's not the best way to handle things. I know you don't like sitting there for hours and all those people asking you questions, and it doesn't seem like they're doing much for you, really.
Maybe.
Is there something that might cheer you up while you're feeling down like that? Maybe some way we can help you not be alone, or...
$1 million?
Good one. But I mean, we could do movie night, or we could go for a walk. We could cook together. There's all kinds of things we could do if you're feeling sad like that.
I guess we could try that.
Well, you have to tell me what's going on before it gets to that point, okay?
I'll try. It's not always easy to know when that feeling is going to come on, but there definitely needs to be an end to that cycle.
Yeah, one of the things I was doing in that role play was not trying to blame the daughter for seeking out the ER, you know. More like just noticing that it seems like it's an unpleasant experience for everyone and not that useful, so let's try something a different way rather than, you know, you keep making us take you to the hospital and, you know, it's disruptive to our lives, because that's how
I'm
they...
sure that's how the parents
yeah,
feel, but
exactly.
Responding that way would definitely not get a good reaction.
Exactly. So that's a little bit of selective sharing, but the other point of view is probably something that's not missed. You know, I'm guessing, you know, that in a well-regulated state, you would know that that's true. That
Yeah.
So if I can follow up, because we actually have a question on almost exactly that. So one of our participants writes in that she feels like she's always validating her daughter's feelings and her daughter's concerns, and she feels like her daughter doesn't really consider her feelings as a parent, as a mother, as a human being. Mm-hmm. And she fears that maybe she's actually somehow reinforcing a negative behavior or a negative way of life in terms of always being centered on herself, her daughter always being centered on her own feelings, and that they're the ones, her feelings are the ones that matter, and other people's feelings maybe don't matter as much. And so you kind of ended that scenario with saying, as a parent, especially in that heated moment, you may not share your concern or your frustration, and I totally endorse that and agree with that, because that will only, you know, it's already a fragile moment and would likely lead to an explosion. But could either of you offer any insight for parents who are struggling with this, just feeling like, oh my God, she's so needy or he's so needy, and I'm bending over backwards, doing everything all the time, and it's never enough. And when do I get to expect some reciprocation in terms of validating my feelings, or in terms of validating my need for love or appreciation or gratitude for everything I'm doing? And how do you even start, like, what would be a good time to have that conversation, and how would you even have that conversation?
I would definitely say, you know your child, his or her mood, and definitely when they're in a calm state. And it is absolutely, you know, important, even for a person with borderline personality, because it can be a very selfish, like, way of thinking and feeling, because you are oftentimes thinking only about, you know, your emotions can be so dysregulated. But it is important to absolutely let them know, you know, at a certain point when they're calm is the best time, to say, when you get this way, this is what it affects. It affects my job, you know, what it is affecting. And that you're bending over backwards for them, maybe not wording it that way, but saying, I really care about you, and I don't always feel like you are reciprocating that, that you're not always, like, how can we work this out so that, you know, you are recognizing that I have feelings too.
The other thing that I have noticed when I've done groups that have been centered around family relationships is that sometimes people with borderline personality disorder tend to have sort of a semi-conscious belief in mind reading, especially that their parents can mind read. So they'll talk quite a bit about their gratitude or their appreciation or, things they feel guilty about because they've taken so much of their parents' money or resources. I would often say, like, did you ever tell your mom that? Well, no. I mean, she knows. Like, well, you might want to say it out loud with words. Like, parents really like that. So, I think that that's also something which is hard to figure out how to do as the parent, like prompt your own child to express some appreciation. But I think you can certainly reinforce it when it happens naturally, like, hey, I really appreciate hearing that, because sometimes it's not that obvious to me whether you notice what I do or not, but it really helps me to know that it matters to you. That can certainly get people to realize, like, oh, okay, I need to say this more, acknowledge things more often.
They done that to my parents and haven't realized, and then when they have them, you don't know that I appreciate it, and it's like, no, I'm sorry, yes, I do appreciate it. And yeah, no, I don't think that I always realize personally that I'm not being thankful for what I do get from my parents. And kind of because I know they're watching this too. But it's hard to, I guess it is true that I think my parents can read my mind and my thoughts, and I don't always say it out loud that I appreciate it. So that is something that, with a clinician, to work on. That your parents can't read your mind, and how do you tell your parents that you appreciate them? And absolutely something that, in the right moment, to talk to your child about that, definitely not when they're having an extreme emotion, but
So Megan, one of the things that you said that I'm trying to think about, like, what concrete advice, if I were to encapsulate it for parents who are struggling with this. I really like the way you phrased it initially, and as I'm trying to, like, make it pragmatic and, like, make a rule of thumb for, like, how do you do this. In my mind, it's more about maybe parents should speak from their own feelings.
Mm-hmm.
That, you know what, when the person's calm, you know what, honey, you know what, son, daughter, whatever, I really do love you. I love you to death. I have loved you since you were a kid. I get that you're struggling. I get that you're unhappy, and I really do try to help in all the ways I can. And honestly, sometimes it feels like I wonder if you love me. I wonder if you even appreciate anything I do. It doesn't feel like you do. It doesn't feel like you care about my emotions sometimes. It does, and that, I think, is less likely to elicit an angry response. It might be like, oh, you're being silly, but it's not like, how dare you, as opposed to, you know what, why are you so selfish? Why can't you think of other people sometimes? Why is it always about you?
Yes, that really doesn't go over so
which is
much.
what parents are probably thinking in some of these heated moments. Like,
Right.
Why is it always about you? Why do I have to be the one to validate? And that's not the right time to have that conversation.
Yeah.
And it still may not get a great response, because it can and may make someone feel shame, like, I didn't think them, or, I don't, and so you may not get a response right away, but it will at least make the person think about it, and hopefully come back with a better, more appreciation for other people and their parents.
Great.
I think another version of that I find I sometimes do as a clinician is, what you're saying is really important. I'd like to be there for you, but let me share what, is going on in my world at this moment, so that the other person, just sort of bringing it into their awareness that it's, I've got this huge meeting coming up, and I'm trying to find like 10 minutes to eat and do this and do this and do this, and like you're asking me to do something that I actually can't do right now, because it sort of forces some perspective taking. So we'll see if we have a couple minutes to just go through the last scenario that we chose, because I think this one is an important one because it's sort of like when you can't validate, or when you ought not to. So this is, here's the situation. I went to visit my son, who lives alone, to bring him some home-cooked meals and food for his cat. When I rang the doorbell at the main entry of his apartment building, he buzzed me in, but when I knocked on his apartment door, I heard nothing. After a few knocks, I tried the door, which was open. My son was in bed under the covers, then said nothing. I unpacked all the food, put it in his fridge. From past experience, I have not had positive results when I tried to draw my son out. So I left and went home. Later, he emailed me a series of messages saying, "Nice of you to stay and chat, stellar communication. I was tired and lying down, wish you had asked, a simple hello to the cats would have been nice. I feel like he's baiting me and doesn't really want to chat, and there is nothing I can say that will be right. He has cut off everyone from the family. I've sent email messages and a card in the mail. What can I do to repair the communication, or do I leave it alone for now?" So understanding the reaction, I would say that, this is a classic example of, the title of a pretty well-known book on borderline, which is I Hate You, Don't Leave Me. So, like Megan had said in her introduction, wanting kind of two contradictory things at the same time. Go away, but, how dare you not talk to me? So there really is no way to win on this one. And you had a lot of thoughts on this, so do you want to jump in?
I mean, I definitely would say that the son is baiting his mom, and that there isn't any way that in the moment that's going to get any better. And she's already done a lot of things to try to repair the communication, which sometimes even just like a little kid, I have a toddler myself, which any kind of attention, negative or positive, sometimes it doesn't matter. Attention is attention. That, again, spinning it around and saying, well, in the past, this has not been positive. I've tried to communicate with you. Same kind of scenario, tried to communicate with you, and you've gotten upset with me. So asking the son, how would you like me to respond? And then go based on what the son says and say, well, if this doesn't happen, then I can't continue to bring you home cooked meals and food for your cats, and you're going to get angry at me no matter what I do.
Yeah, so we both thought this was a time where actually like limit setting is more in order than validation, and that he actually has some responsibility around repairing the communication because mom is trying to be pretty respectful. So yeah, saying like, hey, I can tell you're really struggling, but I can't read your mind. If you want me to engage with you in a different way, you need to ask. You need to let me know what you need and do that politely. And then, if he can't sort of follow through with his own plan or come up with something that isn't just rude or derisive, it is time to sort of back off and let him reapproach. So that's all we had.
Great.
And
No, I
hopefully
think
that was helpful in terms of breaking down some real-world situations.
I think that was tremendously helpful, and we are pretty much at the end of our webinar, so I don't want to get into something that we can't finish.
Mm-hmm.
So a big thank you to Dr. Karen Adler, and an extra big thank you to Megan, our first person with borderline personality disorder to come out and be on our webinar and help people understand. And I thought that your insights were really spot on and very helpful. You could be a clinician. And so thank you both for all